So it's, I think, Eileen, start whenever you'd like. We still have more people signed up, but I don't know if you want to give them another minute or if you'd like to begin.
I think we'll go ahead and get started. If that's okay. We have we do have a whole lot to cover today, so I want to welcome everyone to our Florida Health Funders, Florida Philanthropic Network webinar today. How will the Census 2020 impact Florida's health funders? And really appreciate folks being joining and being interested in this topic. I've learned so much just listening to the planning going on for this session. So I can't wait to have our speakers share that with you. I'm Eileen Coogan. I'm the head or the chair of the Florida Health Funders group. So have been put in the role of helping facilitate this webinar today. Really all I'm doing is I'm not doing any of the work. Shelley Robertson is the worker behind making all of this happen. So I wanted to introduce just very quickly and have introduced the speakers that we have today, and then we'll get right into it. So what I also will ask if everyone will mute yourself on the webinar so that we avoid the extra feedback when you're not speaking, and that way you can control when you're being heard or not heard. But if we could maybe start with Sabeen, if you want to just give a quick introduction of yourself, and then we'll go through the different speakers, and then we'll come back to you doing your presentation.
Sure. Good afternoon, everybody. My name is Sabeen Perwaiz. I'm the Executive Director of the Florida Nonprofit Alliance, and we're delighted to be partnering with FPN on this work.
Okay, and Joni? Joni, we can't hear you.
See, I listened to the directions about muting, but not unmuting.
Well done.
I'm Joni James. I'm the Chief Impact Officer for the Foundation for a Healthy St. Petersburg.
Great. And Natalie?
Hi, everyone. My name is Natalie Castellanos. I'm the Director of Policy and Public Affairs for Health Foundation of South Florida.
Great. We also have Cynthia and John are on the phone from the Florida Philanthropic Network, so thanks to both of you for helping make all of this happen. And as I mentioned, Shelley Robertson, who is an evaluator for many of us, I think, who are on the phone and has done a lot of work helping the Florida Health Funders and Florida Philanthropic Network with some of our planning. So thank you very much, everyone. What we really want to do is take some time to have the folks on the phone understand what's happening with the Census 2020, particularly in Florida, what some funders are doing to support the census work, and then what the opportunities are for all of us. So we're going to really dig right into it. Hopefully we'll have some time for questions at the end. I think you can raise your hand if you have an urgent question in the middle, or use the chat, and we'll be paying attention to that as we go through. We're going to try to kind of move through the speakers as we can, so that we get through to everyone. So I want to just go ahead and start with Sabeen.
All right. Shelley, can you? Great. So while the slides are loading up, I will go ahead and get it started. So FPN and FNA got together early part of 2018 to really mobilize around the census and see what we could do collectively. And are you all seeing slides yet?
No.
Okay. So the first slide is FPN's mission, so we can go ahead and do that while the slides are loading up. And their mission is to promote, develop, and advance philanthropy in Florida through values of leadership, inclusion, collaboration, learning, and integrity. There we go.
There it goes, yeah.
We can start with slide 3. Thank you, Shelley. As far as FNA is concerned, our mission is to advance, promote, and strengthen the nonprofit sector here in Florida, and we are part of the National Council of Nonprofits. So there are 42 other state associations across the country, and we're really grateful to be part of that network. So the conversation that we're here for today is the 2020 census, and the reason we wanted to really get with everyone is because there are a lot of changes coming down the pipeline. And Shelley, we can go to the next slide. And so the census is something traditionally we're well aware of as an entity that's done by paper over every 10 years. And the results are used to allocate federal program dollars to states and local counties. And nationally, that's around 300 federal programs that are allocated towards $800 billion. Florida is currently slated to gain 2 seats. We gained 2 seats last go around in 2010, and we are projected to also gain another 2 seats in 2020. Next slide. It's also the reason why rural, urban, and equal political representation take place. And most importantly, it is a third of our state budget. Next slide. It is also what is used to handle redistricting on the state level. So after the census results are verified and sent to the president, then by the 2020 elections, we are looking at redistricting to see how those 2 seats would be created and where they would be created. As far as the financial impact is concerned, for the state of Florida, that's around $44 billion through 55 programs. And we're currently in the process of drilling down those 55 programs to see which state agencies are funded as well, so we can share that with you probably within the next 2 weeks. Next slide. So one of the main reasons that the census count is important is there's something known as hard-to-count communities, and Florida is home to a lot of them, and we'll go into what that means. But it's also traditionally in English, and it is available in different languages, but for those that are not native English speakers, it can be a barrier, and nearly 30% of Floridians do not speak English at home. Next slide. As far as healthcare is concerned, it is the largest funder for many of the programs that we all know, and they're called FMAP guided programs, federal medical assistance programs. And that includes everything from Medicaid, children's health insurance, foster care, adoption assistance, and child care and development. And some of the programs that most people are not aware of that are also funded by the census include SNAP, highway planning, Pell Grant, school lunch, Section 8 housing, and special education. So why do we need to care? As far as policy and advocacy is concerned, the census data is funding everything that your foundations fund and everything that the nonprofit sector does, whether it be allocating children's numbers, whether it be looking at school planning. 10% of children in the state of Florida were not counted. We're actually a large program recipient for the Annie E. Casey Foundation, specifically for the Kids Count program because of that. School boards, city councils, and of course, most importantly, grant makers will not be able to make up the funding difference. And if Bob or Gila were here, they would say that from the state budget, about 1% is what philanthropy covers on an annual basis. So that gap just can't be covered. Next slide. So when you translate that dollar percentage or dollar figure, so the FMAP programs I mentioned, the Medicaid, Head Start, et cetera, that results to, for every person we don't count, that's roughly $946 lost in funding. And so a 1% undercount of individuals results in $178 million for the state. And in 2015, we received $29 billion. So that just gives you the significance of this count and why it matters. So now we'll go into what's changing for 2020. Previous census, like I said, it was always in the mail. You would get a questionnaire and then you would go ahead, complete it, and mail it back. However, given the recent decline in the census budget, the internet is the primary method for households to self-respond. So why is that a problem? For Florida, 17% of the population has no reliable home internet or only dial-up internet. And 6.4% of the state's household have a cellular data plan, which they probably would not use for this reason. So when this rolls out, the way they will be reaching out to individuals is via postcard that will go out sometime in March. This postcard will include secondary ways of responding, which will include a toll-free number and a traditional questionnaire. But if individuals do not look for that postcard or keep that postcard, they won't know how to go ahead and respond. And then finally, for the addresses that were given to the Census Bureau by those local counties, anyone that has not responded, they'll get an in-person knock on the door from the Census Bureau staffers, hopefully hired within the community, to get them to complete it on their own time. Next slide. So hard to count communities. These are the communities that most funders, most nonprofits, most stakeholders are worried about as far as the count is concerned. And 15% of Florida's current population is considered to be in hard to count communities. So what is a hard to count community member? So these are individuals that are at or below poverty level, receive some sort of public assistance, immigrants living in isolated communities, or migrant workers, high concentration of low education attainment, 5% or more who speak a language other than English at home, single parents, young children. So children under 5, you know, there's a theory that just they're little, people just forget them. And so they're one of the highest undercounted individuals. Renters, because they move so much. And then of course, scattered mobile homes, campgrounds, and then high crime areas, and then unreported housing units. So if we don't know they exist, then they probably will not be getting the postcard. And then grandparents raising grandchildren. They just, you know, there's a loss in translation of who should be counting them. So the parent doesn't count them and the grandparents don't count them and they end up being forgotten. Next slide. So as far as dates are concerned, early last year is when all of the counties sent back their addresses. So the Census Bureau sent address verification databases, and then any new developments that were created, any new housing facilities, they were sent back to the Census Bureau. In 2018, the regional census centers have opened across the state. In 2019, field offices. And then also in 2019, complete count committees. And we'll get into that later with Natalie. And then of course, Census Day is April 1, 2020. I referenced the postcard. And so people do not have to wait until April 1 to complete, go online and complete it. They can complete it as soon as they get it. But April 1 is the official day. Next slide. So complete count committees, I'll talk about it a little bit from the state level. Out of the 50 states, there are currently 18 states with no complete count committees. So what that means for us is on a statewide level in both 2000 and 2010, the governor is the one who appoints members to be on the state count committee. And then it gets some sort of legislative appropriations towards outreach marketing that is RFP'd out to different agencies across the state. This is the first time that we have not had a complete count committee established on the state level. The reason that it's already late is because the legislative session is over and the fiscal budget will start this fall going into next summer. And so the census funding would have to take place between that spring and summer session. There is currently a outreach within the Senate Democratic Party to appeal to the governor's office to create a complete count committee. The other piece to mention is Rick Scott has also said that he strongly believes that the count should only be focused on citizens, and he's okay with Florida losing dollars and seats. And so just knowing that political landscape, I personally am not sure that the governor will still create one. So what that means is now there is, for those that have been doing this work for a decade or more, they're waiting for that green light to come from the state level that unfortunately is not coming. So there's a loss in communication around when to start, when to mobilize. So it really is on the local communities to start reaching out, and FPN and FNA have been traveling across the state to do that. But also there are around half of the counties in Florida with complete count committees. And so I think we'll share that list out with you so you can see if your community has one and how you can plug in. So next slide. So as far as foundations are concerned, I think a couple of things to think about are, one, what can your individual organization do to start raising awareness? Anything as little as adding a page on your website, or talking about this with your grantees come January, come this fall, talking about the local count committee. You know, do you have a representative on that committee? Have you been in touch with that committee? How can you get plugged in? And then I think for different communities, there's different action items. For some, we're looking at doing nonprofit workshops to train the frontline staff that work within those hard to count communities so that they're better prepared, they know what to look for. There's already a template on the Census Bureau's website around how the new form will look online, what the postcard will look like. So visuals are available that can be shared and get people familiarized. You know, they say that someone has to see something 7 times in order for it to retain and for them to do something. So thinking about the easiest thing for me would be for you to think about what those 7 touch points would be between now and April 1, 2020, so people are more likely to actually move forward. And so with that, I think we'll cover resources in a little bit, but both FPN's website and FNA's website have a census page. Our website focuses a lot on resources that nonprofits can use. There's social media collateral, And there are funding sheets so people can look at the financial implications for Florida. They can look at the kids count data and really FAQs around that process. And of course, for FPN, there's grant maker resources on civic participation, working groups, and really the campaign for getting states and cities mobilized. So with that, any questions?
Sabeen, thank you so much. And I'll mention to everyone, as Sabeen said, that we will, a lot of resources are available both on the FNA and the FPN website, and we'll also provide the slides from today, the slide deck to everyone who participated. I think it'll just be up on the Health Funders page of the FPN website, and this is also being recorded, so so if you're madly scribbling notes, we'll be able to provide those resources for you. Sabeen, you did a great job covering a lot in a short period of time. We do have maybe a couple of minutes for a question or two before we move on to hear from some specific examples from Joni and Natalie. So are there any questions? You can unmute yourself to ask. Okay, then we'll continue on then. And Sabeen, thank you so much. I think everyone does know we have just a really wonderful partnership between FPN and FNA, and really appreciate the opportunity to work together. And I can't think of a better issue to work together on than this. It affects so many of our communities and people. So next up is Joni James from the Foundation for a Healthy St. Petersburg. And you can don't forget to unmute yourself.
Thank you, Eileen. Thank you, and I'm going to say, you know, Sabeen and FPN is the reason that actually the Foundation for Healthy St. Pete even is on this call to a certain extent. We were attending the Florida Philanthropic Network meeting last year when there was a census workshop, and that is how we quickly saw that this is definitely in line with our mission. I want to talk to you about that because I'd also want to encourage anyone else on the call, figuring out why the census makes sense to your mission, I think is a great way to sort of frame your engagement. We see that with sort of anyone who walks in the room in the work we're doing, that if they can identify why they care so much about it, they really bring a lot more energy to the effort. So we are and I also want to say my story is quite a bit different from Natalie's, where I think there's a little more infrastructure locally in her communities around this effort. So I sort of think we're a nice combination here. We're a conversion foundation. We're only about 6 years old, and really we only have the mission we have now for about the last 3 to 4 years. And that is we are focusing on impacting systems to eradicate disadvantages that lead to poor population health. And health inequities. So the easiest way is we look at the social determinants of health, as many of you know, and we actually tend to shy away too much from healthcare. We look more at things like transportation and housing and education, and you immediately can think all of those are affected by the census. So if we can affect how our community is counted and make it more accurate, that means we're going to have more resources for our community, and that means we're going to have a healthier community. So that's why we engaged. Next slide, please. So when we came back from FPN last year, and I started talking to people, community leaders about the census, I could not find a single person still in leadership who had actually worked on the census 10 years ago, except for one gentleman at the city of St. Petersburg. So I just sort of want to put that out there for you, that is part of the challenge of the census, is that people age out of this work. It's pretty rare to find someone who's worked more than one census because this isn't their day job every day. It only happens once every 10 years. We also quickly, in learning more and more about the census, we work through convening models. We like to work through multi-sector convenings to tackle problems. And we quickly realized that complete count committees are multi-sector collaborations. So just like there is ideally we would have a state complete count committee, there then is usually a county complete count committee. And then individual groups may do their own, such as the city of St. Petersburg might do one. You might have faith-based organizations come around and create a complete count committee. But we quickly realized we really wanted to engage with our county complete count committee, recognizing that sort of the infrastructure muscle around this was was not necessarily there. We wanted to make our mark there and trying to push for leadership and to get that effort started. So actually beginning last year, we started lobbying our county commission members to designate this and to appoint people. Well, it was an election year, so it took a while. So frankly, our complete count committee just got seated back in May. But in the interim, we were doing a lot of talking. We used our electronic newsletter to let people know about it. We started using our social media to talk about the census when we could. We established relationships with the census staff in our region. So I got to know the woman who oversees, I think it's 15 counties in Florida. So I've actually known her and gotten to meet every single person she has hired for this year's effort. So that's good, and it's just helping with relationships and helping to connect those workers who often aren't, they often are hired locally, but they may not be the most connected people in your community. And frankly, having someone from a philanthropy help them know who's who is very helpful. We were also pleased, we were offered to lead the undercount committee for our county complete count committee, and that's a rephrasing from our county commissioner who's leading it. These aren't hard to count people, meaning he found that a little derogatory, so he calls it undercount committee, we think is also very appropriate. So our county actually has about 9 subcommittees. The interesting thing is that they all really are focusing on the undercounts within those sectors, and we are really working hard to try to bring them together. Next slide. So I talked to you about, we've already done some awareness building and planning through so the complete count committee now is meeting. We are really at this point trying to create, to merge databases, if you will, of all those that are involved in the complete count committee, identifying what resources there are in the community to help get this message out, both now, building up awareness, getting those 7 touches as Sabeen talked about through the end of 19, and then how do we convert to an action plan or more of a campaign. We have let it be known, we had a local coalition of nonprofits who wanted to seek some money from the New Venture Fund, which I believe is a Gates Foundation offshoot, to do some outreach work here. We worked with them not only in saying we would provide some of the matching dollars they needed to show that they could get locally, but we also frankly helped them craft their vision for what that system would be if they got the grant. And in other words, we encourage them to work with the complete count committees. We encourage them to be at the table with the complete count committee to magnify so that any dollar that got spent locally on this effort was coordinated and maximized. Unfortunately, they did not obtain that grant, but just that whole process created greater awareness around the census, and we sort of now have identified some really natural partners in our undercount communities of color in particular. Some of the ideas that we've come up with, none of these have been committed to yet, but we are also, Pinellas County is no longer the oldest county in the state, but we have a large senior population. And so we are actually looking at how do we augment any census communication around alternative forms for internet use. We've become very aware just in some of our complete count committee conversations, how using the internet in any way for personal information can feel very invasive for elderly people who aren't used to, they don't necessarily shop at Amazon. They don't necessarily, use Netflix every day. So that's a huge cultural barrier that did not even exist 10 years ago. And now it's sort of a new challenge. And frankly, we are worried that we risk undercounting the elderly population just as we undercount the youth in our community. We're also starting to, so how can we explain to them the telephone mechanism or requesting a paper survey? We're also really trying to think of creative ways to deepen access to computers in undercounted communities, and mostly we're looking in this cases at we're looking at concentrations of poverty, immigration, and communities of color. And we're talking about purchasing some mobile computer tablet units, really just a utility cart that would have, say, 5 to 10 Surface, Microsoft Surfaces on it that have cell phone accounts to use them and partner with some nonprofit agencies who will commit to going out and taking those units into the community every day. Can we book them every single day over a 2-week period, for example, to try to capture people who might not otherwise be captured? Every 10 years, there is an effort to look at libraries and schools and government buildings as places to provide that public access for the internet. We're looking to expand that even more. So for example, we are building, our foundation is opening a Center for Health Equity later this year. We already know that we're going to advertise extensively that you can come to our office at any time and use the computer to answer the census. And we're also talking about creating some kind of incentive. Perhaps the foundation helps purchase gift cards that could be given away to those groups who prove, individuals who come and complete the census and actually perpetuate. Because one of the things that we realize is this is a campaign, and really the only thing that matters, it's a little bit like an election. We can do all the communication we want, but ultimately it's really going to be about getting that person to vote that day, or in other words, to cast their census form. So that's sort of where we are in our efforts. And I'll be happy any questions now or later, whatever y'all prefer.
Does anybody have a question for Joni before we move on to Natalie? Okay, Natalie, you're on.
All right, perfect. Good afternoon, everybody. I also have some slides, and there they are, quick. Thank you, Shelley. So good afternoon, everybody. My name is Natalie Castellanos again from Health Foundation of South Florida in Miami. Next slide, please. So my objectives over the next 10 or so minutes are to explain why it's a priority for Health Foundation of South Florida, to describe our efforts, what we've been doing in Miami-Dade and Broward counties, and to hopefully support more statewide collaboration around census, because at the end of the day, as much as we've really been getting into our community and really supporting the counties in our region, this is a statewide issue. And so we're really happy to both connect with and engage with partners who are thinking about getting more involved and support them, but also hopefully some of you are already engaging in some work. I know Joni and I this has been a great opportunity for us to get to know each other and potentially work. And special thanks to the Florida Health Funders Group and FPN for hosting this conversation. We're really, really grateful to be here. Next slide, please. So like Joni, I always use the Health Foundation's mission as sort of the guidepost to inform what and why we are doing this work and really prioritizing and uplifting census throughout this year and into next year. So our mission is to invest in and be a catalyst for collaborations, policy, and systems change. So kind of like that's one half is the investment and serving as that catalyst through convenings, through collaborations, and multi-sector partnerships like the Foundation for Healthy St. Pete. And we are focusing on low to moderate income populations in South Florida, and we work specifically in Broward, Miami-Dade, and Monroe counties. We pretty much every year have our board approve a set of policy priorities. My role as director of policy is to use that set of priorities to guide the way that I'm sort of setting up my time throughout the week. And census is one of our 8 designated policy priorities. Some of the others range from improving access to healthcare, affordable housing. We too are looking at social determinants of health. And so census is one of our big priorities for this year, which helps me divide up my time across all the different work that we're doing. Next slide, please. So why census? Joni, I think, captured a lot of this, and I'm happy to just once again compliment those of us who are health funders, especially health funders with a lot of public health folks guiding the work. Like at Health Foundation, the majority of our staff have backgrounds in public health. And so I know in public health, there's a lot of talk about going upstream. I myself don't have an MPH or any background in public health. I'm actually a public interest lawyer. I specialized in healthcare access issues for low-income populations here in South Florida before joining as policy director. But I think because I have worked with health providers and public health folks for so long, I've gained some of that knowledge through osmosis. So to me, census is about as upstream as we possibly can get. So we know healthcare providers, and we see in the data, healthcare disparities are the result of inequities. And in a lot of cases, a lot of inequities are stemming from the distribution of resources, let's say. So census is crucial and touches on so many things. One, there is not, now that I've been paying attention to census, there is rarely any time that I'm presented with a data set or watching some sort of webinar or presentation, it is rare for census data not to be relied upon in order to make a point about data. So whether it's looking at the number of people that live in a given county, whether it's median home prices, the number of renters, the uninsured population, the number of foreign-born individuals. There's so much data that we rely on. And actually to the right, we recently gave a presentation to our county commission and used census tracked data to reinforce points about health disparities to our county commission. And getting into census level data is absolutely crucial, because otherwise I think when we're looking at even county level data, we're not getting a complete picture of which communities are left out. So census is crucial for data. It's crucial for funding. I know both Sabeen and Joni have touched on that. If we don't have an accurate count, there is no way that philanthropy is going to be able to step in and make up for that. There's talks from the 2010 census that there was actually some census tracts where not a single child was counted. And so what's the practical impact of that? There's not enough Head Start slots for those communities. And so when families take their children to get enrolled in pre-K and can't, a lot of that is connected to census. And finally, representation is important. I don't need to reinforce that. So, and once again, it's very mission aligned. In South Florida especially, we have a high number of foreign-born residents in Miami-Dade County. It's about 60% of the population. Low-income households with children under 5. Sabeen really did a great job of covering those populations, and those populations are all around our state. Next slide, please. So for a little comparison, as we were preparing this, I mentioned that I had been at a presentation a couple of weeks ago at the Council on Foundations meeting, which was here in Miami. Some of you may have been there. And there was a group from California that was talking about the census work that they were doing. And it was really, I thought it serves as a stark contrast to what's been happening in Florida. So California, let's say we all know California is very different politically. It's the most populous state in the country. And there's a lot of differences. Florida, though, we are the 4th or 3rd most populous state in the country behind Texas. Obviously, we're politically different. But there's no difference in needing to get census, right? We've kind of talked about why it's so important. So California at the state level has committed $100 million to census outreach, plus an additional $54 million at the state level. Like Sabeen mentioned, Florida this past session and in previous sessions would have had the opportunity to allocate some money. We know that that didn't happen. We're hopeful that something can happen, but as of this moment, to our knowledge, there's no state level funding that's going to support census outreach. Now in California, their statewide philanthropic partners have also gotten together to put money aside that's a little easier to access, and as of the counts that they were presenting at, they had about $30 million pooled. And then there's regional philanthropic funder pools that are working in California. I'm going to talk about in a slide or two what's been happening here in Miami-Dade County, and happy to sort of share those resources and give ideas about regional funder pools. And then in Florida, what I think is happening is things are happening on much more local levels. I know certain counties are going to be allocating funds to support census outreach. And so I guess it's to be determined how much outreach funding is going to go to our state. There's a really helpful resource nationally that talks about specifically how much money is needed to support outreach. And so the very, very conservative small amount is $2 per person in a hard to count community or an undercount group. That would be minimum outreach, perhaps touching people using some kind of mail delivery system. And in order to do really substantive, sort of the one-on-one canvassing, one-on-one conversations, it would cost about $75 per person. So if you start multiplying that out, Sabeen gave the number of several million, somewhere around there, and you start multiplying that out, you get a sense of what is the need across the state for us to fund this adequately. We probably are not going to get there realistically at this point, but we can try. We have lots of time from here until census day next year. So that's one of the big motivators for us, is to try to get these numbers up for funding and just get a sense of how we can support. Next slide, please. So what's our timeline? It's a little more detailed. I actually think I liked Sabeen's timeline. It was a little cleaner, 2018, 2019. So pretty much right now, through the end of this year, we're doing our best to just get a sense of the landscape and understand what are our counties doing here locally, what are philanthropic organizations doing locally and across the state, and what are community-based organizations. Joni mentioned that there's lots of different, there's county level complete count committees, there's opportunity for state level, like Sabeen mentioned. We know here in Miami, we have the county level complete count committees, but there's also, for example, a Haitian American complete count committee. So just interfacing with some of those groups to see what they're doing is important to us. Earlier this year, there was a sort of census kickoff. A lot of you may have seen in your own local communities, press conferences, media. There was sort of a flurry of activity. I know FNA and FPN did a lot of activity around the April 1st date. So that was a big date for us. And basically, we are going to spend the next year just working on outreach, supporting, and the tools that we're using to do this as a philanthropic organization is grant making, education, communications, and working in coalitions. And then Sabeen, I know, already touched on what's going to happen early next year. So next slide, please. So the way that we've ended up having to divide this work, I would have loved to figure out a way to not have to divide between Miami and Broward counties, but both counties end up being very different. So there's sort of different activity going on in both counties, and Health Foundation is involved in different ways. Broward County, fun fact, maybe Sabeen could confirm this at one point in the future, but it is my understanding that Broward County was actually the first county in the country to set up a complete count committee. I am not sure if that's true, but I've heard it, and I'm going to share it here because I think that's important to note. Broward County has a pretty mature complete count committee. It is led by Commissioner Nan Rich, and they started meeting earlier this year. In January, they had a big kickoff meeting. And so typically what I would have noticed about the county level is whenever they have their big kickoff meetings, it means it was preceded by several months at the very least of background activity and organizing. So Broward County is very organized. There is a complete count committee with 6 subcommittees, and we completely coincidentally, like the Foundation for Healthy St. Pete, are co-chairing the Hard to Enumerate subcommittee. And that actually came about more because I attended the kickoff meeting in January and probably talked a little bit too much at my breakout table. So I am now co-chairing that with a community-based organization executive director, Mark Adler, who is Meals on Wheels executive director down here. So what are we doing as co-chairs of the Hard to Enumerate subcommittee? We are coordinating meetings, we're setting the agenda, we're supporting communications, and we're really working on trying to engage more philanthropic partners in Broward County. So for example, the Broward Community Foundation has agreed to commit $10,000 to support messaging and message testing for the hard to enumerate population. So we're calling it hard to enumerate. I really like Joni's point about that potentially being a problematic term, but that's sort of the terminology that we're using. And we're really hoping, because the county is so organized and has so much resource and capacity to do outreach. We are really trying to filter a lot of the work through that infrastructure. We're trying to get more philanthropic partners to the table, showing up to we have monthly meetings. And so we're really grateful that we have the opportunity to work with Broward County in that way in close collaboration and use that infrastructure. Next slide, please. Miami-Dade County looks pretty different from the effort. So Miami-Dade County has not a complete county at the complete count committee at the county level. We actually have a task force that was created by the county commission, somewhat serving a similar role to a complete count committee, but in a lot of ways not doing a lot of direct outreach in the same way that a complete count committee would do. Health Foundation is not a member of that task force. The task force includes mostly government departments and some universities and some other nonprofit partners. What we have been doing is we've been in communication with the commissioner's office who's leading that work. We've been sure to sort of tailor and coordinate so that we're not duplicating. We are hoping though to saturate messaging and sort of saturate people with Census, but we have been in communication with them. What's taken shape in Miami-Dade County that's been really great is the Miami Foundation received that new venture fund. I think it was Joni who talked about supporting round 2 application. I think probably round 1 or round 2. So Miami Foundation received the round 1 funding from the new venture fund. And so they've been able to use that support to support convening of funders and philanthropic groups working in Miami-Dade County. So if anyone's on the phone that does some work in Miami-Dade County, please join us if you haven't already. And so the Funders Collaborative is primarily interested in grant making, coordinating on communications, supporting outreach, and doing a little bit of advocacy. So thus far for grant making, we actually, as a collaborative, applied for the round 2 funding ourselves, did not get it. So happy to sort of talk offline potentially with a few folks who might be interested in reapplying. There's going to be a round 3 and round 4 for more statewide work. But what we are trying to do is pool as much funding as possible, and then Miami Foundation is actually leading an RFP process. They'll be using their systems and infrastructure in order to grant to group in Miami County outreach. We are coordinating on communications. So for example, on April 1st, 2019, we joined in with FPN and FNA and did a social media campaign. We were intentional about sort of retweeting each other and using common resources. And so we've continued to do that, as well as, again, funding more focus groups and making sure that the messaging that we get out to our hard to enumerate, our undercounted populations, has been tested on our local population so that we know that it makes sense to them, that it moves them to end up participating. That is all to support outreach. We've been sort of doing outreach ourselves. We, for example, hosted as a collaborative community conversation a few weeks ago where we invited nonprofit partners to the table and just talked about census and got people's ideas and sort of took the temperature. Finally, advocacy. Some of our groups are able to do advocacy. And so during session, for example, we organize a letter to the Miami-Dade delegation in support of the 2 bills that we're proposing to create a state complete count committee. Didn't end up working, but at least it was a good opportunity to get folks together and sort of get them educated on the importance of census. And again, Miami Foundation has been a crucial partner and leader. They have the in-house capacity. They have this funding to support it. Not every community is going to have that. For example, Broward doesn't. That's not to say that there's not a lot of work that different philanthropic groups can work on. So that's what's going on in Miami. Next slide. Finally, this is a really helpful slide. So I would say California and Michigan seem to be 2 states, if anyone wants to look to states that are really advanced in the way that they're approaching census and the way that philanthropic partners really are engaging with census. I would say California and Michigan are 2 places to look. So this is a slide that comes from Michigan, and it just gives ideas of different ways that philanthropy can support census. What can funders do? So it's fund, educate, advocate, champion, partner, and promote. I talked a little bit about what we've done in Broward and Miami-Dade that have supported these efforts. Been a lot of work. It's been a very rewarding experience thus far. And like I said, we have until pretty much this time next year, kind of building up to a critical moment, I would say around February, March, and April of 2020. So it is certainly perfect timing for folks that want to get involved. And I really look forward to hopefully collaborating with more of you moving forward. Next slide. And that's just my contact information. So please get in touch.
Thank you so much, Natalie. Any questions for Natalie before we move on to more conversation? Shelley, maybe you could go back then to Natalie's last slide. So this might be actually a great slide for us to have up as we enter into the next conversation, talking a little bit about what some other funders are doing around the state. And I'm also thinking back to Sabeen's slide about asking this kind of the what next questions. How is your organization raising awareness? How have you connected with your local complete count committee and interest in holding census workshops? So think about sort of those kind of that slide and this slide, both giving some examples of ways that we as funders can be involved. So we wanted to, with this next section, I'll turn it over to Shelley to facilitate if there are folks who wanted to share a little bit about what they're doing or how they think they might be able to support the census.
All right, great. Yeah, I think Eileen kicked it off well there. So we'll just open it up if you want to unmute yourself, and I think just about everybody is. Really open discussion as to what people are doing, what people are thinking, what people have heard that other funders have done. So would anybody want to kick us off with anything you're doing, anything you're thinking about doing, or even things you've heard that others are doing that sounded kind of interesting to you?
Hi, this is Erin with Allegheny Franciscan Ministries. Can you hear me?
Yes, hi,
yes.
Erin.
Oh, good. Just wanted to make sure it's working. So I just wanted to go ahead and start with a couple of things we're doing, and it touched on some that have already been shared already. So initially, one thing we're doing very informally and not super intentionally yet is some social media posts and newsletters. We're, planning several strategic social media Facebook posts about the census over until April, or the month of April, would say at least. And actually probably after that to get those who have not completed their census to, as a means of doing that. Although, our reach as a foundation may not be reaching those undercounted communities, but keeping that in mind that hopefully that is funneling down to those folks. But some of the more strategic ways that we are planning to engage in these types of activities are through our grant funding, similar to what the Funders Collaborative is doing in Miami. So, and we actually have a board meeting this week, and so we have a particular recommendation that we're making, but I believe it's okay to share, right, Eileen, what we are planning on doing. So we do plan on giving some funding to the Miami Funders Collaborative to help support that larger effort that was just mentioned, Natalie just mentioned. So we have staff that have been serving on that committee and developing the application, the RFP, and that will be making some of those funding decisions as well as contributing money there. And that's for Miami-Dade, since they have an existing group together. And then for the other two geographic areas where we fund, Palm Beach, Martin St. Lucie, and then Pinellas Hillsborough, through our TAO grant cycle. These are smaller grants of up to $10,000 for organizations with budgets of $2 million and less. We will be having the intent is to have a grant cycle devoted to that. In the past, it's been for capacity building. So this fall cycle would be devoted towards census outreach, advocacy, communications. So hopefully that will complement the work that the Foundation for Healthy St. Pete is doing. Just wanted to share those.
So if I remember correctly, the first seminar I ever went to, Sabeen, you mentioned, I think, that foundations can help by providing grants. So I'm gathering, Erin, that your grants will help folks reach out to communities, like spread the communication. Is that the goal with the TAL grants? And then I was going to ask Sabeen what maybe other funders, what types of things they're funding. So I don't know if they're funding.
Yeah.
Mm-hmm.
Yeah, so it could support a variety of things. And we actually looked to what the Funders Collaborative was doing in Miami just to get some more practical ideas of types of projects that would be funded. So it could be really targeted outreach to undercounted communities. In fact, I want to have a question in the application that says, which communities are you seeking to, serve? So, since that data is available, I mean, I was just looking at a map, and Homestead in Miami-Dade has the lowest, it says, in the entire country at like 28%. So just really focusing on some of those communities. So that would be, a target. It's very much in line with what the Miami Funders Collaborative is doing.
Okay. So what are some other types of ways that people are supporting the census financially? And then I want to maybe move on to what foundations can do in terms of advocacy. But have you heard of other things, other types of things that foundations are funding, either here in Florida or elsewhere?
Yeah, so I love that Natalie mentioned Michigan. So I was actually with the Michigan folks last week in DC, and their FPN and FNA counterparts are working together on this outreach, and it's a lot of statewide coordination. So as it was mentioned earlier, the funding has been around statewide outreach. So reaching out to all of the count committees, reaching out to all the counties, aggregating data to analyze which of the counties in the state are the top 10 highest counties as far as low undercounts are concerned, and then identifying partners within those local areas. So Michigan's focusing a lot on empowering individuals on the state level to do better work on the local level. The other piece is partnering with the business community. So really a public-private partnership, kind of like what Joni mentioned around technology, because that's going to be the biggest hurdle to cross over. Looking at those low undercount areas and figuring out how do you get more devices available to those individuals. I think walking with the devices is great, but for some of these communities, there's a fine line between walking around and asking people to open their doors and do it in person, or is there a community-based action agency in that neighborhood that could do that, or after-school programs? The funding varies. Outreach and collateral is another big one. So for a lot of the high undercount communities, there are a lot of different languages involved outside of those 11 languages that the census is translating in. So some funding has been specifically to translate collateral and the form into those languages based on the local communities. And so that's something where we've been exploring too. FNA has reached out to all of the count communities that have been established and asked, how can we help? How can we better coordinate you? And ironically, Broward was one of the first to reach out because they need help translating pieces to Vietnamese, and they just haven't been able to do that. And so we're working with them to see how we can help them do that. The other piece I would say is there's a great hard to count map, and I think on the resource slide that you shared from our PowerPoint, it was the first link. I would highly encourage everyone to map out their own county on that map and see where the internet access issues are, see where the hard to count population rises, and look at that number, because that will help you identify what the need is, as Natalie mentioned, the $2 per person being the bare minimum. And then finally, if you are on a count committee or working with one, see who's missing. It should not be the usual suspects. So is faith present? Are the immigrant communities present? Because if it just looks like us and speaks like us, and then we're not including the hard to count community members, it's not going to have the purpose that we're trying to accomplish. So.
Okay. Eileen, I think we are ready to probably do follow-up and next steps. Before I turn it back over to you to kind of wrap us up, I also just want to see, does anybody else have a comment or a question for the speakers, something that they'd like to share, or a point just to raise?
Natalie's here. I actually have one last thing, because this is the Health Funders Group, and I should have included some mention in my slide, so I apologize. So I talked a little bit about messaging and the importance of getting the right messages. So there is a lot of national message testing that's been done, and it shows that certain communities respond to different forms of persuasive talking points. So some groups find it's constitutionally mandated, it's safe and secure to be more compelling, and other groups find it more compelling that census is used to allocate funding for communities and it's good for schools and safety. And so understanding that. In addition, messaging is important, but the messenger is crucial. And it has been shown that doctors and healthcare providers are among the most trusted messengers for census participation. And so as health funders, I imagine people have deep reach in healthcare provider communities around the state and in their own regions. And so one of the things that I've been trying to think about and trying to engage with some healthcare partners that we have is just what is appropriate? What does it look like? Ideally, doctors would be having these conversations in the exam room, but we know realistically they're not going to do that. So I would just encourage us all to be thinking about how we can promote census to healthcare partners.
That is, I'm thinking that it'd be really great to do almost like a briefing about this webinar with the information that was shared, and boy, that would be a great point to include in that. Thanks, Natalie. So Eileen, I'm going to turn it back over to you to wrap us up.
Yeah, thanks. We have just about 2 minutes to go, so I'll try to do that pretty quickly. As I said earlier, we will have all the information from this webinar, the slides and a recording will be available for everyone, and FPN will send those out to you, and it will be on the FPN website. I really encourage folks, if you haven't yet, to get involved with FNA and FPN around this work as we try to figure out how best to work together. Michigan is a great example of, and California, of when people across the state really work together to make something happen. It's much more powerful than the important work that we are each doing in our local communities. But really do encourage you to use this as an opportunity to reach out and try to be involved together. Anybody else on the webinar? What am I missing that we need to do as follow-up? That's what I had on in my head. Am I missing anything else?
I don't think so, except that if the presenters are willing, I really would like to perhaps write up a couple-page briefing about this to share more widely. I'll let everybody see it before it goes out, but I think that would be really helpful, because we did have quite a few people signed up, at least 4, I think, signed up that didn't make it. So I'd like to be able to share that with them, maybe others as well.
I think that'd be terrific. And go ahead, Sabeen.
I just want to add one thing, that if you are able to advocate and reach out to your electeds, one thing on the federal level that would be really helpful is asking for a fully funded census. So while we were in DC last week, and then while FPN went up on the Hill, we both advocated for that, and we've shared data for each district with each elected official as far as hard to count numbers and hard to count individuals without internet access. Most just aren't thinking about it because it's next year, but coming from funders, that certainly goes a much longer way. So if you all are able and willing to do that, I'm happy to provide you with a template.
Great, thank you. And Natalie, you were talking just now about messaging and some resources and data around messaging, and it'd be great to, I don't think that's on our resource list that we have, so I personally would be really interested in learning more about that, and anything that we can use, so that'd be great to include too.
Definitely will.
Okay. 30 seconds for any last words. So I want to thank Sabeen in particular, and Joni and Natalie for sharing your wisdom and experience with us. That was really great. Erin for chiming in with some of what Allegheny is doing, so thank you for that. And Shelley and the folks at Florida Philanthropic Network, of course, for all the support in getting this webinar going. And we look forward to the next time that we spend together to learn.